medicine is a practice that I started here in Fargo in July of 2019. And it has been quite a journey. Started out the first year and a half with just me. And since then, have hired on some nurses and also some front desk staff. And now we've got some technicians. And so now we have a team of 10 people, which it's been fun to grow into. And it's amazing the reception, the acceptance of what it is that we do. But what makes what we do even more exciting is the fact that we get to change people's lives every day. And so just to give you guys a little bit more of a background of who I am. So I'm Trevor Hausauer. I'm a family nurse practitioner, certified in functional medicine through the Institute for Functional Medicine. And so as I was going to school, I was wondering what it was that I was going to do, right? And so one of the things that impacted me the most as I was growing up is I had a brother who had some physical challenges, and we did a lot of doctoring down at Mayo Clinic. We did a lot of doctoring down at University of Minnesota, and having a hard time getting a diagnosis, but also gave a lot of opportunities for experiences in the medical realm. Some of those experiences were really, really good. Some of them were not so good. And so what that did and what those experiences did is it left an impression on me to say, hey, I want to be one of those people that can give an amazing experience in some of the hardest situations as much as I can. And so as I got into college, trying to decide what I wanted to do, initially started out thinking I was going to do medical school. However, after a little bit of time, figured out I didn't want to go to school for 8 years before I even started seeing clients, and then looking at another 4 years of residency and all that just wasn't the right fit for me. And so nursing ended up being a great fit. And what I did is I got into nursing school, got my first job in the ER and ICU. And when I got there, it really left an impression on me. You know, we can do amazing, we can do great work, but a lot of those clients that were in those situations should have never needed to be there. And so as I kind of contemplated that, I said, well, what can I do to help keep those people from being there? And those people that should have never been there are those people primarily with chronic health concerns, right? Who are either mismanaged with their medications, they're mismanaged with just their medical care in general. And so I figured out, you know, I want to be able to see those people outside of the hospital, be able to educate them so that they can make the best choices for themselves, and hopefully be able to keep them from ever needing to be in that situation. And so while I was working in the ICU, I said, you know, the best way to do that is outside the hospital before they ever get to this point. And so decided to go back to school for my nurse practitioner. While I was getting my nurse practitioner degree, of course, we have clinicals. And one of my clinical instructors is Rhonda Jolliffe, and she's an amazing nurse practitioner out in Bismarck, North Dakota. And as I was going through that schooling, and while we were going through some of those cases, we would oftentimes present our case and give our diagnosis and our recommendations. And oftentimes she would agree or disagree. And sometimes what she would do is she would say, and think about adding this, and that this sometimes was ashwagandha or rhodiola or magnesium. And so I kind of picked her brain. I said, where in the world are you coming up with that? And what she did is she turned me on to the Institute for Functional Medicine. And that really just totally resonated with me. And so what I did is I started diving down the rabbit hole of what functional medicine was and the principles of it. And as I did that, it kind of, it in a sense became a passion. It became an obsession. And so I needed to put that away while I finished up school. But once I finished school, I used all my continuing education money to learn functional medicine principles and be able to integrate that in my practice. Started out my nurse practitioner career in internal medicine at a larger health organization here in town, and had a great experience, as far as being able to help out clients and be able to see them. Gave me an opportunity to be able to relate to clients from their conventional medical experience. But I also found that I couldn't do what I wanted to do while I was in that medical arena. And so what I did is I said, hey, you know what? I'm going to continue to do my very best, be able to learn as much as I can, and actually used all my continuing education money from that health organization to learn my functional medicine education, which was amazing. And then what happened was I was a part of the Army Reserve. I got deployed overseas to Kuwait, and I was there for 9 months. And while I was gone, God gave me the opportunity to say, hey, you know what? I'm going to have an opportunity to step aside and be able to do what God has given me a passion to. And so I look forward to just being able to continue doing what we're doing, treat people in a way that they need to be treated to help them to be able to achieve health and not just put Band-Aids on symptoms. And so one of those tools that we use here at Valley Vital Medicine to help people in a very, very powerful way, to help them to be able to get their energy back, to be able to get their health back, is IV therapy. And truth of the matter is, it's hard to find a way to be as effective as what we can do through IV therapy, because we're able to get direct access to the inside of the body. And there's not very many ways that we can do that. And IV therapy is one of those ways. So we've got 9 of you on here live. So thank you so much for being here live. It's exciting to have you here. For those of you who are just joining us, please, if you would, drop in the chat where you're joining us from. And if you have any questions as we go along, please put those in the chat as well. As we get to the end of this presentation, I will be answering those questions at the end. And then at the end as well, I'm going to be announcing the winner of the drawing that we had. So here we go. All right. So right now we are going to be talking about IV and injectable medicine here at Valley Vital Medicine. So we're going to talk a little bit about the history, the nutrients, the benefits, and how we utilize these therapies to be able to get the best results. All right. So disclaimer, this is something that unfortunately we always need to put in place just so that we are kind of covering ourselves, right? And of course, I'm recording this. It's going to live on for forever, hopefully, unless it gets taken down. I pray it doesn't. But so the information we're going to cover today is really for educational purposes only. I'm not diagnosing anybody today. I'm not offering a treatment plan. I'm not telling you what's right for you. We are here just solely to give you information so that you can know perhaps what the right best thing for you is, or for you to chat with your medical practitioner about to see if it's right for you. So this information is not to diagnose or treat any health problems or illnesses or anything like that today. Okay. All right. Got that out of the way. So let's talk a little bit about the history of IV therapy. So IV therapy actually has been around for a long time, even going back to the 1600s. However, the problem back then, of course, is we didn't have a whole lot of cleanliness or scientific methods. So there wasn't a whole lot of success. I don't know how many people died from trying to give medications or give fluids by IV back in the 1600s. I would expect that it would actually be quite a bit. So it'd be kind of scary. But in the early 1800s, Dr. William Brooke O'Shaughnessy, he found that many of his sick clients who had cholera lost a lot of water and saline. And so what he did is he was able to essentially create his own saline, and utilizing a syringe and a silver tube. So silver is antimicrobial. So he was able to revive 8 out of 25 clients that he thought would have died otherwise with saline. So this is one of the first times that this has really ever been utilized successfully in a medical arena. Now, of course, the world wars, as tragic as they are, they do give us an opportunity to have amazing advances in technology, but also in medicine. So during World War I and II, there's a huge need for medical care, which brought about the advent of modern IV therapy and primarily started with the need for transfusion of blood. So this is really kind of where IV therapy came from. So what is IV therapy? So most people are pretty familiar with what IV therapy is. What we're going to do is utilizing a needle and a cannula. So the needle actually is in the inside of a little plastic sleeve. So the plastic sleeve is actually what stays inside the vein. So a lot of people think that when we put a needle into the vein that the needle stays there, which is not the case. The little plastic sleeve stays there. We take the needle out, and then so all that's left is that little plastic straw. Okay. So the goal of this is to give us access to the bloodstream so that we can deliver fluids or take blood out, but also give other nutrients or other therapies, excuse me, directly. So many of us use oral supplements, of course. They do have some benefit, and we utilize oral supplements every day here in the practice. However, the reported absorption rates vary from 10 to 20%. Okay, so that is for a person with good digestion. How many of us actually have good digestion? And I would say many of us actually don't. So with IV nutrients, the benefit is we can get 100% of those nutrients directly into the bloodstream. We're not wasting any of it. So the nutrient levels of our food also are significantly decreased from what they were just a couple decades ago. We have been really hard on our soils. We are doing, single crop rotations when we're putting fertilizer on the ground. Of course, we are just providing the nutrients that allows those plants to grow in a way that we need them to, so that we can harvest them in a good amount of time, right? However, many of the other minerals and nutrients and those things have been significantly depleted from the soils. Plus, with the advent and use of lots of pesticides and herbicides and those things, that kills off the beneficial bacteria and things that used to live in the soil. So again, we're not getting the benefits of that in our food any longer. So in order for nutrients to be therapeutic, okay, so there's a difference between what we need to stay alive, but we also have a different need that will help us to be optimal. And to be able to be optimal and live to our very best health, we need to have higher amounts of nutrients. So oftentimes that even will transcend or be more than what we can take orally, because our digestive tracts are not efficient, but also our digestive tracts, oftentimes the receptors in our gut can become saturated, and that causes us then to have loose stools and not be able to absorb any more of that nutrient. And this is especially common and true in vitamin C and magnesium, especially. So Myers cocktail. Many people, when they think about IV therapy, will think about a Myers cocktail. And this is something that we have on a regular basis when people call the clinic and say, hey, I'd like to get in for an IV. I'm interested in doing a Myers cocktail. So where does that come from? So that comes from a physician. His name is Dr. John Myers, and he's credited with what's known as the Myers cocktail. So he developed this in 1954. His goal was to utilize IV micronutrients to help his clients with their sicknesses, asthma, fibromyalgia, fatigue, migraines, all kinds of other conditions. And so what he did is he put together calcium, vitamin C, magnesium, B vitamins, and he put that intravenously right into people's bodies and had great results with this. So this science has continued to progress. and continue to expand. And we're figuring out how many nutrients are going to be the best, are going to be optimal for people. And so we're always learning new things and individualizing things for people. However, one thing to know when it comes to the Myers cocktail, there's really not a standard Myers cocktail out there. So if you get a Myers cocktail in one place, it could be different than what you get at another place. So keep that in mind. Myers cocktail doesn't always mean the exact same thing, although it's a general classification for these nutrients in particular. Okay. So at Valley Vital Medicine, I started doing IV therapy in the fall of 2021. Since that time, we've done thousands of IV therapies here as a part of our practice. So I've taken a multitude of different classes, lots of different certifications. I even traveled down to Reardon Clinic down in Wichita, Kansas, to learn their high dose vitamin C protocols. They are the standard in vitamin C therapy. They have been doing high dose vitamin C for the last 50 years. They are responsible for the vast majority of research in vitamin C IV therapy and just vitamin C in general. So I had some clients who were contacting our office asking for high dose vitamin C. I honestly didn't know a whole lot about it at that time. We were doing some of the other therapies, and I said, you know what? I need to figure out how to do this correctly and how to do this safely. And so that's when I got a hold of Reardon and went down and did some training with them. So one of the things that I'm committed to here at Valley Vital Medicine is bringing in the highest quality, the safest nutrients that are available. So we work with compounding pharmacies within the US to utilize the highest level nutrients that we can. And so each of our nurses are trained in how to do this as well. Okay. So what to expect when somebody comes into the clinic. So this is a picture of the IV room that we have, or part of it anyway. So you can see at the end there's an IV chair, there's a couple other recliners, and this is actually about half of our room. So the other side of the room looks very similar as far as what we have. If somebody calls the office and wants to do some IV therapy, what we do is we set them up with an IV consult. And that IV consult is with me, where we go through your history, we go through your medications, your allergies, your goals, and any concerns that you might have to make sure that we are adequately making sure, number one, that you're safe, but also that you are reaching your goals and that we're not doing something for you or to you that you're not wanting or that you're not expecting. And also just talking through that process, making sure that you have a good understanding of risks and benefits and that you are making the best decision for yourself. After we go through and we do that, I will walk you down to the IV room, introduce you to one of our nurses. We have amazing nurses who have done hundreds or thousands of these IVs. This is what they do all day, every day, is start IVs on people. So one of the things that many people are worried about is, is this nurse going to be able to do a good job of starting my IV? And I will say I get compliments regularly on the proficiency of our staff and their ability to start IVs. So I'm super proud of them. They do an amazing job. And so at our clinic here, we actually only employ RNs who are starting the IVs as well. So they have a great background of knowledge, but also great at doing the skills of what they're doing. And so our nurses are trained very well to make sure that they are doing things in a super safe manner, in a clean manner to avoid any risk for infection. When they mix up the IVs, they are doing that right at the time that you show up. This ensures the ultimate in cleanliness and safety, because when we take the nutrients out of that bag or out of the vials and we put it in the bag and then we give it to you right away, honestly, there's no time for bacteria to even grow. Okay. So that's one of the things that allows us to be super safe. Also, we use a filter with all of our IVs to make sure that we are doing a double check to make sure that anything that potentially would be in that bag that would cause any problems is being filtered out. So what you're getting then is just super clean fluids and the nutrients as well. The environment is very friendly. Again, our nurses are really, really good at what they are doing, making sure that you feel comfortable. Again, we have these massage chairs and also recliners to make sure that you're comfortable. And really, our goal is to make this a relaxing place, an enjoyable place. It's not uncommon for me to hear laughing from down the hall from where my office is, and everybody seems to be enjoying themselves. It's also a great time to just sit back, relax, maybe close your eyes. We do have a brain tap that you can use for doing meditation as an option while you're here as well. Bring a book, whatever would make it the most comfortable for you. Afterwards, I would say there's a few things that people will notice after they do an IV therapy. Number one, sometimes people feel a little worse. Okay. That worse means like more tired. So the reason that happens sometimes is oftentimes because people, frankly, are just so deficient that when they get these nutrients, that it gives their body the nutrients that it needs for them to be able to detox. And for you to be able to detox appropriately, you need to be able to rest. And so that is why oftentimes we'll see more fatigue after that. Now, another option is sometimes people don't really notice much of anything. So a couple different options with that. Number one, maybe we didn't get enough of the nutrient that you needed. Or number two, maybe it's just not the nutrient that you needed, right? So that is a bit of an unknown, and we can actually do some lab to look at the nutrients that you need. So that's something that we can do as well. But third, and what I would say that we see by far the most often is that people will have an increase in their energy. They'll feel more rested. They will sleep better that night. They perform better with their exercise. Their brain comes back online. They think clearer. They get over their sicknesses quicker. They aren't getting sick nearly as much or at all from what they had previously. So those are kind of the three different responses that people will oftentimes see after getting their IV therapy done. Okay. So who's a good candidate for IV therapy? Really, pretty much everybody. Okay. If you have chronic health concerns, if you have fatigue, if you have digestive concerns, such as gastric bypass or gastric surgery. So think specifically about those people that are not able to digest their foods well, and they're going to be nutrient deficient. These IV therapies can be life-changing for those people. People like fibromyalgia, Lyme disease, smokers have a higher level of oxidative stress, and they are nutrient deplete because their body is always trying to deal with those toxins. Cancer, we have several cancer clients that come through our office weekly. Acute illness, so if you feel like you're getting sick, if people around you are sick and you want to protect yourself and try to keep from getting sick, IV therapy is a great way of doing that. Wellness. I do IV therapy periodically or regularly myself just to keep myself healthy as well. Athletes utilize a ton of nutrients. They sweat a lot, and really they have a really high standard for their performance. So for athletes, IV therapy can be amazing, and optimization in general. So thinking about NAD, ozone, high dose vitamin C, those therapies can be really, really amazing for just helping people to optimize their health. So who's not a good candidate for IV therapy? So we need to be really careful, really judicious, especially for those who have any sort of heart, liver, kidney disease. If you are really anemic, it would be another one, so that your blood counts are really low. We got to be careful so that we don't dilute your blood too much. And so that's exactly the reason why I do a consult or a screening before we start doing IV therapy on anybody. A G6PD deficiency. So this is a genetic deficiency that would cause your cells to be more fragile under an oxidative stress. So in other words, if your cells are exposed to an oxidative stress, so that means ozone therapy, high dose vitamin C, methylene blue, what can happen is those cells can burst. And as those cells burst, we can run a risk for anemia, a lot of health problems with that. So what we'll do is before we start ozone or high dose vitamin C, methylene blue, we will get a G6PD level on all of our clients. So it's just a simple lab test we can do. It's pretty cheap. It's only about $30. And so that test specifically will allow us to be able to know that we can do those, be able to do those treatments safely. So again, I sit down with each client before they start their first IV therapy, make sure that there's not any contraindications. So that way we help you to make sure that you're reaching your goals and we can help optimize your results and your health as we go. We want to make sure that we're being judicious with the treatments that you're doing. So our main IV drips. So we have a few here, and these are all the ones that we're going to talk about today. We have what's called our executive formula, our natural defense, our fountain of youth, glutathione, our performance drip, ozone, high dose vitamin C, alpha lipoic acid, NAD, and methylene blue. And these drips particularly allow us to take care of a wide variety of people and help them reach their goals. So what are they? The executive, and also it's known as the Rise and Shine. So the executive in Rise and Shine, the only difference is that the bag is a different size. So a half a liter bag is the executive. The Rise and Shine is the full liter bag of saline. What's included in these drips are magnesium, calcium, thiamine, riboflavin, pyridoxine, niacinamide, dexpenthenol, and cyanocobalamin. So what you'll notice there, the magnesium and calcium, but all of the rest of those are all B vitamins. Okay. So what you get from this mix of nutrients is improved energy, better brain function, hydration, and I would say improvements for sure in physical, and your ability to perform and do physical activity, just because we're getting that additional hydration into you. So contraindications for this, heart and kidney failure, of course. So the concern with heart and kidney failure is that we would be giving you too many fluids. And so we have to be really judicious about that. So time to be able to get these IV drips into you, yeah, somewhere around that 45 to 60 minutes or so. Natural defense. So natural defense is at its basic, utilizing 500 milliliters or just half a liter of saline. However, we certainly can do this in a larger bag and do a full liter of saline as well. So essentially what this does is it just builds on that previous executive formula we just talked about, and it adds 15,000 milligrams of ascorbic acid or vitamin C. So if you think about vitamin C, when you take it orally, most people are taking anywhere 500 to 1,000 milligrams at a time, right? So if you're digestively only taking in and utilizing 10 to 20%, if your gut's working well, you're not getting in very much. And in this case, we're actually able to get 15,000 milligrams into your body right away, 100% into your bloodstream. Oftentimes, we'll also add zinc to this for people who are struggling with acute illness or need to stay healthy. So benefits with this, again, energy, brain function, hydration, and giving you that real immune system boost. So contraindications are the same with heart or kidney failure, and still about that 45 to 60 minutes as far as the infusion itself. So natural defense. So when we look at this, I wanted to lay out for you what the benefits of some of these different nutrients are. And as we look at this, so the magnesium chloride, magnesium is so crucial in all of our cells and helps with benefits in nerves, muscles, bones, your heart. And you need this to be able to function healthy and to be strong. The calcium is really great for brain health, and also can be be implicated for anxiety and moodiness. Okay. Thiamine. So this one we think of a lot with depletion in people who suffer or are drinking alcohol too much. And so thiamine obtains energy from the foods. So from the foods you eat by turning nutrients into usable energy. So you need thiamine to be able to use other nutrients. Okay. And again, so people that drink a lot of alcohol, it blocks thiamine. So now you can't utilize these other nutrients. So how important is that? Riboflavin B2 is a micronutrient that's easily absorbed and just helps with energy and keeping you functioning well. Pyridoxine or B6 is one of the more common nutrient deficiencies that we will see. And one of the things that can cause deficiency in B6 is stress. How many of us are struggling with stress? I know I get stressed pretty regularly myself. Niacin assists in the functioning of the digestive system, the nerves, and helps, again, transform your food into energy. B5 is necessary for making more red blood cells, and along with all B vitamins, helps the body to convert proteins, carbohydrates, and the fats you eat into energy. So if you feel like you're eating a lot of good, healthy things, and you're not getting the most out of those nutrients, you could be just B5 deficient. Cyanocobalamin or B12 plays a significant role in forming red blood cells. Many people who are anemic oftentimes are B12 deficient, and it's not uncommon for me to see really low levels of B12 here in the office. Ascorbic acid, we're going to talk more about vitamin C here shortly, but it is crucial in the immune system, and without it, you actually can die. So it's really, really, really important that we're making sure that we get enough vitamin C in. Okay, so let's talk about the difference and why we utilize the nutrients that we do. So the natural defense that we have in comparison to a normal Myers cocktail. So you can see here the significant differences in the amount of the nutrients that are in each of our IV drips. So I know there's a lot of other IV bars out there and places where you can go get a Myers cocktail. And is that beneficial for you? I would say it is, right? It's better than doing nothing. But look at the differences here in regards to the amount of nutrients that you're getting when you come in and you're getting a good high quality IV from us rather than, maybe some of the other places that are doing a general Myers cocktail. We're just going to be more efficient at helping you make a bigger difference in your health in a shorter period of time. So the Fountain of Youth. So the Fountain of Youth, again, utilizes basically the 500 milliliters of saline, but it can be increased to a full liter again. Really, this is the same as the natural defense, but what we're doing in this case is we're adding 2 grams of glutathione. So the benefits are that we get added assistance in our detoxification and improved skin health. Okay. Contraindications are the same, and time to administer, again, so kind of that 45 to 75 minute time frame. I'm going to go more into glutathione right now. So what are the benefits of glutathione, and why should we utilize glutathione? Glutathione is your most potent antioxidant that your body normally makes. Okay, you make this yourself. However, as you age, you make less and less glutathione. So what does glutathione do? So it removes free radicals and decreases oxidative stress. So oxidative stress is the rusting that occurs in your cells as your body works to create energy. It helps to detoxify toxins, pollutants, and drugs so that you can help get rid of them easier. So glutathione, again, is decreased as you age. It's decreased as you experience stress, as you have lack of sleep, as you have toxin exposures. And frankly, our world is just full of toxins. Our water is dirty, our air is dirty, our food is dirty. So we need this detoxification help. So contraindications, there's a potential for a reaction in those who have sulfur allergies. Sulfur allergy is not the same as a sulfa allergy. Now, we will be cautious in those people, but it's not the same. Sometimes people will feel a little bit of a head rush or fatigue. And the reason for that is because it is pushing those detox processes and it's helping to people to be able to achieve better health. So glutathione specifically is actually being studied for beneficial effects in Parkinson's, HIV, and AIDS, and also cancer. So it's also used for skin benefits. So what it can do is it can help lightening the skin. It can reduce fine lines and wrinkles. It can reduce dark spots. Now, one thing to keep in mind for cancer clients who are coming in getting high doses of vitamin C, they should not receive glutathione on the same day because the high dose vitamin C is causing a stress on the body, and we want to allow the body to experience that so that way it has its full toxic effect to those cancer cells. So glutathione, so recommended frequency is depending on goals, right? So if we are doing it primarily for skin health, it's actually the recommendation would be 2 to 3 times a week for 4 to 9 weeks, and then kind of reassess where you're at with your goals and where you're at with the skin lightening effect, and then also fine lines and wrinkles and all those kinds of things. We'll talk about recommended frequency for the rest of IV therapy here in a little bit. So our performance drip. So the performance drip is, I would say, is another one of our really amazing IV drips. And for some people, this one has been an absolute game changer. It's really, really great for hydration. You can see that it's in a full liter of saline. And the levels of the ascorbic acid is not nearly as high, but what you get in this is you get a full amino acid blend. And what that does is it helps to support the recovery of the muscle and also the performance. You'll also see there's a mineral blend, which can help with muscle performance as well. So a lot of our athletes really, really like and love this IV too. So benefits here: hydration, recovery, and muscle relaxation. So again, contraindications are the same as what we've seen previously. So again, about 45 minutes to an hour to be able to get that IV in. All right, ozone therapy. So let's talk about this for a second. Ozone is what I would say is a cornerstone of what we do here. I actually started doing ozone therapy way before I started doing IV vitamin therapies because it is a really cool and really effective therapy. And we were the first ones in our area to be doing ozone therapy. And so we have kind of 3 different ways of doing ozone therapy here. We have major autochemotherapy, high dose ozone, and what's called EBOO. Ozone is O3. Okay, so pretty much everybody knows of oxygen, right? Oxygen's O2, ozone's O3. So essentially it's supercharged oxygen, and the body utilizes oxygen to process 96% of your nutrition. Without oxygen, you die. And ozone is a really great way of helping to get the body to perform at a better level. Okay. So there's different concentrations of ozone. And that is determined by myself. When you come in, we do your consult and talk about your treatment plan. And the concentration of ozone is called gamma. And so we have dosing of ozone anywhere from 3 to 68 gamma as you're getting these IV therapies. The reason we don't go above 70 gamma is because up and above that, we can actually damage the blood cells. But below that, we are oxygenating and creating healthy change in the blood cells. So what's different between the major autochemotherapy, high dose ozone, and EBOO? Major autochemotherapy treats about 60 milliliters or 60 cc's of blood. Okay. And so with that, then we can then treat that 60 milliliters of blood with 3 times that amount of ozone. So anywhere from 60 to 180 milliliters of ozone gas at the concentration that I determine as a part of our treatment plan for you. High dose ozone treats about 330 cc's or milliliters of blood, which is about similar to a unit of blood. And so again, we treat it then with 3 times the amount of ozone, so about a liter or so of ozone gas. EBOO. EBOO is the most advanced form of ozone therapy that currently exists in the world today. It treats about 2 liters of blood. And so what it is actually we start 2 different IVs on somebody that's doing EBOO therapy. Blood comes out one side, goes through a dialysis filter where it's continuously ozonated and oxygenated, and then it goes through an ultraviolet light, and then it comes back to the person on the other side. And this is a continuous therapy for about 50 minutes. Now, so the total amount of blood that's treated with in that treatment is about 2 liters. So because the therapy is continuous and the effectiveness at which it is able to be performed, we actually get the equivalent of about 30 major autohemotherapies or 10 to 20 of our high dose therapies in one session. So the benefits of ozone therapy is we're able to directly infuse oxygen right into the blood. It's been shown to have the following effects. So antibacterial, it's antiviral, antifungal. It helps to improve detoxification, improves vasodilation, improves mitochondrial function, which means you have better cellular energy production, and it promotes immune system balance. So it's super, super great for autoimmunity. And it also really does a great job of reducing inflammation. People that I've seen do really well with this as well are those people that have chronic pain, fibromyalgia people, and really see a nice reduction in inflammation and pain. So indications, people that do really well with this: chronic illness, chronic inflammation, people that have viral illnesses, cardiovascular and pulmonary disease, autoimmunity, chronic infections, mold, Lyme, anti-aging, wellness, and just performance and optimization. So now one thing to keep in mind, ozone's not necessarily right for everybody, right? So there are a few contraindications, and that's if the platelets are really, really low, if you cannot clot, if you've had a recent hemorrhagic stroke, a recent heart attack, and that means within the last few hours, current alcohol intoxication, G6PD deficiency, uncontrolled hyperthyroid, pregnancy, especially in the first trimester, and really has to do primarily with medical legal reasons. There actually are some research studies that have shown benefits in pregnancy, so it's kind of interesting. But of course, the litigious world that we live in, really the recommendation is not to do in pregnancy. So to administer these therapies, it's about 45 minutes for major autohemotherapy, 60 minutes for high dose, and about 75 to 90 minutes for EBOO. We do block about 2 hours for EBOO just to make sure that we have the best setup and it's not a rushed experience and that everything goes well. So before we do any ozone therapy, we do need you to do a full established care visit with me so that we can go through your lab and make sure that we have our G6PD or at least one in the works. And then we need to maintain regular visits to make sure that we're doing this safely. And again, that we're helping you to achieve your ultimate goals. One thing that you'll see on here is it says we always include UBI. So UBI is ultraviolet blood irradiation. So the ultraviolet lights, UVA, B, and C, are used in this case to treat the blood as well. So what that does is actually pretty much the same thing ozone does, just in a little bit of a different way. So in some cases, if somebody is just treated with ozone without the ultraviolet light, we can sometimes see that people have like a little bit of a detox reaction or something along those lines. But in ozone, if we include the ultraviolet light, then generally we don't see that, and people do really quite well. We see people feeling well, lots of energy, and just have a great experience with that. And frankly, it's that's one of my favorites by far. In fact, I love the EBOO too. That's something that get amazing results with. So NAD, this is one that you can find a lot of information on online. There's a lot of excitement about it, and really the goal with this is to affect the body's ability to produce energy. Okay. So I describe NAD as like the gasoline in your cells. It's the thing that gives you the fuel to make energy. So as we age, our NAD lowers, which results in a slower metabolism. Okay. So if you experience fatigue, if you experience brain fog, it can be just from a lack of NAD. NAD can help you to improve energy and also fight addiction. So there's actually some really interesting research on that. Dosing on NAD is somewhere between 250 to 750 milligrams. And again, this is going to depend on the person and also what their goals are. So benefits have been seen with this, with memory loss, chronic or acute fatigue, brain fog, lack of focus, addiction and withdrawal, or neurodegenerative conditions. So thinking about Parkinson's, Alzheimer's. It's also been used for athletic performance optimization. I've heard of some pretty cool stories of, even professional football players who go in for NAD IVs, and they get them almost daily. There's no issue with toxicity with NAD IVs at all. So again, contraindications are the same as what they are in any of our other IVs. So NAD is a little bit of an interesting it's a little bit of an interesting IV in just the effects that people feel while they're doing the IV. So think about it this way. If we are giving you a huge amount of energy, how you feel that is going to be very different than if you're just getting IV nutrients, right? So what people will notice as they do NAD IVs is they will feel that energy. So they will get potentially could get headache, flushing, can get stomach cramping, a sense of nausea or shortness of breath or chest tightening. It doesn't have anything to do with risk for cardiovascular events or risk for heart attacks or anything like that. It's just purely that amount of energy can give you those symptoms. Now, it's an okay thing to get those symptoms. Okay. Now we can give the IV as quickly as we can, depending on somebody's ability to tolerate those symptoms. Some people do really, really well, and those symptoms don't hardly even phase them. And other people are much more sensitive and they go much more slow, and that's okay. There's nothing wrong with either way. So it can take anywhere from 30 minutes to 4 hours, depending on the dose and the speed at which somebody is willing to do the infusion. And generally what we'll do is we'll show our clients where the clamp is so that they have access and control as to how fast that IV is going to flow. Okay. And frequency of dosing with this is going to be a little different depending on what your goals are. So for addiction, really, this should be done pretty much daily for a minimum of a couple weeks in a row. For people who are looking for brain performance optimization, loading dose recommendation is 5 infusions within a 2-week time frame and monthly thereafter for maintenance. Again, there's no toxicity for this IV. So one of the things that I noticed when I utilized or did an NAD IV is that my brain was really sharp. I also noticed that my vision had really changed and that colors were much more bright and vivid, and just really felt like my brain was firing on all cylinders. So that's what I noticed when I did NAD, and it was a real positive experience. And in fact, I need to get myself set up for another one here again sometime soon. Alpha lipoic acid. So ALA is probably another one of those super common IVs that we do, and we do pretty regularly. ALA is a potent antioxidant, and what it does is it assists in recycling of other antioxidants such as vitamin C, E, CoQ10, and glutathione. So generally, we give this in just a 250 milliliter bag of saline, and we are dosing this anywhere between 250 milligrams to 600 milligrams. So ALA has several different benefits. It's been shown to improve glucose metabolism and insulin sensitivity. So it's great for people who have metabolic syndrome, diabetes. It improves the conversion of carbohydrates into energy. It reduces fat storage. It slows memory loss. It can fight premature skin aging, reducing oxidative damage and inflammation. And also it helps to support healthy nerve function, reduce neuropathy. So a lot of we've actually had a few clients that come in and will do ALA IVs twice a week for 4 to 8 weeks for improvements in neuropathy symptoms. And frankly, we've seen good results with that. ALA can also support cardiovascular health and help boost the immune system as well. So the contraindications with this, we have to be careful with people who are taking diabetes medications, purely because if we help them to function better and they don't need as much of the medication, we can drop their blood sugars too much. And so that can be a risk, and that's something that we would talk about. But again, otherwise, kidney, heart failure, the other contraindications here. Potential side effects, honestly, I've never seen any of this, but they say nausea, rash, itching, abdominal pain, nausea, vomiting. So again, I haven't seen any of that, but it is a theoretical risk. So time to administer, this is a little bit shorter of an IV, oftentimes done in about 20 minutes or so. High dose vitamin C. So high dose vitamin C is vitamin C itself is a required antioxidant. So without it, we can develop rickets and we can die. So if you think about sailors back many, many decades ago, or a couple centuries ago, people that were crossing the oceans that did not have any vitamin C were dying, and they were trying to figure out why. And they figured out that vitamin C is a crucial nutrient, and if we don't have it, then again, we can develop rickets and we can die. Now, a lot of chronic disease has at its root oxidation as a central part of what's going on. So by utilizing vitamin C, we can help to create balance in the body again. Vitamin C is one of those things that it is easy to underdose, but it's impossible to overdose. Okay. Now, orally, you can reach what's called bowel tolerance, where if you take more vitamin C, you're not going to be able to take it anymore because you're going to get loose stools. However, we can give you IVs of anywhere. So remember when I was talking about our natural defense, it has 15,000 milligrams in it. We also have given IVs here, particularly to a lot of our cancer clients, of upwards of 150 to 200,000 milligrams or 200 grams. We always include magnesium in this, just because there is a shift in regards to like calcium and magnesium and all that stuff. So the magnesium helps keep that balance. Vitamin C has been shown to have a lot of benefits in acute and chronic infections. It reduces pain and inflammation. Several of our clients who go for, say, dental surgery or surgery in general, I will have them do a series of high dose vitamin C as well as ozone before and after their procedure, so that they have improvement in their wound healing. They have less pain, they recover faster. We also have had clients that come in and do like some of our PRP facials where we utilize a microneedling pen. When we do that, giving a 50-gram dose of vitamin C along with that will dramatically improve their ability to heal. So high dose vitamin C has been shown to reduce CRP, which is an inflammation marker. It improves blood flow. assists in wound healing, fracture healing, bone density, improves mood, energy, endurance, improves collagen production. So one thing to keep in mind, if you are taking collagen, if you're taking protein powders and you're not seeing improvements by doing that, if you're not taking vitamin C, it's not going to happen. Vitamin C is required for you to produce collagen. Okay. So vitamin C is great for skin health. Also in diabetes, it can help to improve their situation as well. It's great for vision, helps to improve allergy symptoms, and also has a real prominent role in people who have cancer as well. So again, I traveled to Reardon Clinic, and they have shown that people that utilize high doses of vitamin C, and this can be done alongside of chemotherapy, radiation, and it can also be done on its own without chemotherapy, radiation. So one of the things that we do with our cancer clients is I do tell them, up front, I'm not a cancer specialist. However, I do know some things that do cause or that do make people more susceptible to having cancer. And so we talk through that. We also talk through how to utilize high dose vitamin C in cancer. So while we're doing that, the recommendation for therapy for cancer clients is to come in minimum of twice a week, and that's per Reardon Clinic's protocols. Okay. Now it can be done every day and it can be done safely. And ultimately, it's up to the person and how aggressive and what their investment looks like as far as what they want to do, and how often they want to come in. However, if somebody said, hey, I would like to come in every day for a 100-gram dose of vitamin C, of course, we would make sure that there's not any of these contraindications, but depending on their goals, we certainly can do that. It's something that is incredibly safe. And again, you're not able to really overdo it. There's no toxic level of vitamin C. In fact, I'm going to do an additional training on vitamin C and also ozone in the coming months. So keep your eye out for that. That's something that will be coming as well. Methylene Blue. So methylene blue is a really, really cool IV nutrient. So, and actually it's not a nutrient, it is a pharmaceutical, but it's one of the first pharmaceuticals that was ever developed. Methylene blue. So let me clarify this real quick as we're talking about this. Methylene blue, there's two different sides of this. There's a pharmaceutical side, and there is a side that's utilized for dyeing clothes or just for other uses other than medical. Do not use any of the other than medical use at home. There are people that are doing oral methylene blue. In fact, I am as well. And there's a lot of benefits to that, and we can talk about that at another time. But do not use anything but medical use methylene blue, because those other methylene blue products have a lot of toxins. They have a lot of heavy metals in them. The pharmaceutical grade methylene blue does not have that. Now, you may find that there's a lot of research. There's a lot of talk out there right now about methylene blue and the benefits. So with dosing with this, so we do put this in D5W, which it has to be in order for it to be done safely. So dosing with this, usually 10 to 20 milligrams. The full dose in a day needs to include whatever somebody's taking orally, is not to exceed 2 milligrams per kilogram. So if it's a bigger person, we certainly can go up on the dose. So methylene blue has been used for and showing benefit in balancing redox. So in other words, that oxidative stress, improving that, decreasing inflammation, improving mitochondrial function. It has benefits in mental health and depression. It's a weak, what they call MAOI, which is a type of antidepressant, but it's not so strong that we have any of the negative side effects. You'll see that people are also utilizing this in anti-aging. It's also an antimicrobial. So originally it was used for chronic urinary tract infections and other just chronic infections. Um, and so generally in the conventional medicine world, it's used for methemoglobinemia. So what that is it's carbon dioxide poisoning. And so because of that, methylene blue is actually present in every ER across the nation. Now, because of how it works, this also can be really, really beneficial for people who have cancer as well. So to get the full antimicrobial benefits, it's best to actually combine methylene blue with red light therapy. So red light therapy actually activates methylene blue and helps it to be more effective, and it can carry oxygen better and have better antimicrobial benefits. So when we do give methylene blue, we do have a red light that we put around somebody's arm when we do that. So contraindications for methylene blue. Of course, if somebody has an allergy, if they're on either methylphenidate or Adderall for ADD or ADHD, if they're utilizing SSRIs. So the reason for that is if they're taking those medications, it can cause an increased risk for serotonin syndrome. Okay. G6PD deficiency is another one, similar to ozone, high dose vitamin C. And if we have significant issues with heart and kidney failure as well. This is, again, is a shorter IV, anywhere 15 to 30 minutes. Optimal use of this is 1 to 2 times a week for 2 to 3 months, and then can be done 1 to 2 times a month as needed. Okay. Now, so those are the primary IV therapies that we use. Okay. Now, it's possible to stack these therapies one right after the other. However, it's really important that we do this in a certain order. So we can do these things kind of one after the other throughout the day. And again, it's important to in what order we do that. So first, if we're going to do that, we need to do ozone therapy first. Anything with vitamin C would be after that, followed by methylene blue, followed by ALA, followed by glutathione. And so if somebody wanted to do ozone followed by glutathione, of course we can do that, but this would be the general order in which we would want to do those things. So injectables, we have a few different injectables or shots that people do when they can come in here. One is the mix shot, which is also known as a weight loss shot. This is great for improving metabolism, helps with energy, nerve function, improving red blood cell production. So this can be used alongside a healthy diet and exercise to help you break down fat, and are done once a week until you reach your health goals. Okay. Vitamin D. A lot of people take oral vitamin D. We have some people that just don't respond or don't get their levels of vitamin D up by utilizing it orally. So we can do injections once a week to get your levels up much, much quicker. And then this therapy, these injections are dependent on your blood levels. So we need to make sure that we see your lab, or we can draw your lab here to see where you're at to determine if you need this, and if so, what dosing. And that dosing is something that I prescribe for you specifically. So B12, we do B12 shots as well. B12 is one of your most needed nutrients, especially when it comes to energy. So the B12 shot can help with energy, brain clarity, and pretty much anyone can benefit from these injections. But especially those who are shown for being B12 deficient on your lab work. Frequency with this can be once a week to once a month, kind of depending on what your levels are, what your goals are. B complex, we do B complex injections as well. They cover all the water soluble vitamins in the B group. So B1, 2, 3, 5, and 6. So these injections have been found to improve energy, mood, hair, skin, nails, heart health, metabolism, and immune function. NAD, these injections are the same as what's in the IV. However, we're able to just give it, and generally we give this subcutaneously. So not in the muscle, but kind of in the fatty tissue. The benefit for addiction, brain optimization aren't quite as likely to be realized if we're just doing NAD injections. However, we have had several clients who were long haul COVID clients that absolutely love these injections and came weekly for or every other week for a long time, and really notice improvement in brain clarity with utilization of those injections. So when's it a good time to get an IV? So as a prevention, and really that frequency can be a little bit up to you. For a lot of people, when they get started, it's important to remember that it's kind of like trying to build yourself back up, right? So it can be like like going 2 steps forward and 1 step back every time you get an IV, because we plus you up with a lot of nutrients, and then your body uses it as it needs to, and then we get another IV and it gets you a little bit higher as far as your nutrient level, and then your body uses it. And so eventually we're getting you up to where you need to be, but it can take time. And so oftentimes for people as they get started with IVs, I talk to them about, hey, come once or twice a week for 4 weeks. And then after that, go to every other week for maybe a couple months. And then after that, go to once a month. And that's going to be a really great initial way to be able to get your levels up. Now, we can utilize this in prevention, so doing a natural defense periodically, or any of these IVs periodically. We also see a lot of people that come in before they go on vacation because they want to make sure that they're as healthy as they possibly can be while they're gone, because that's a really, really bad time to get sick. If people are starting to get sick, important that that we're able to get those nutrients in, especially those high doses of vitamin C. Viral recovery. So people that oftentimes get sick, we don't we've seen a lot of people just really, really struggling to kind of get over that hump. They're tired, they're fatigued, and that can go on for weeks or months sometimes. And we will get people in that we do sometimes a fountain of youth or an ozone and a fountain of youth on the same day. And really it just kind of kicks them out of that sickness and into their full recovery shortly after that. So that is something that we've definitely seen. Cancer, again, we talked about this a little bit already, but staying on top of some of these nutrients, especially the high dose vitamin C and ozone, is really, really great for that as well. Helping with athletic performance, and these IVs can be done a couple times a week or once a month, depending on goals, and then anti-aging as well. So how to get started? So check out our website. It's valleyvitalmedicine.com, and we have a services tab up front or on top that says services, and then drop down it says IV infusions. So you can go there, you can learn more about the different drips, the timing, the prices, and all that stuff is listed there. The consult that I do with clients when they come in for their first IV is free. So just talk through what your concerns are, what your goals are, and how we can help you. So there's a place right there to register for your free IV consult. Look there to see if there's a time that works for you. If you don't see something that works for you, I would encourage you to give the office a call. Sometimes there are slots available that just don't show up online. Now, when you come in the first time, I invite you and would request that you come in a few minutes early, fill out a little bit of paperwork. You can kind of get associated with our office, find out where the restrooms are, meet our staff. And then what we'll do is we'll sit down for your initial consult and to discuss your concerns, your goals, and help you to make sure that you're making the best decision, the best investment for you. So again, we talked about this a little bit already, but the recommended frequency, this is going to depend a little bit on you and what your goals are. We can do once to twice a week for people that have chronic health concerns. Again, acute illness, we can do daily or even multiple times in a day to try to help you get over those illnesses much, much quicker. So again, we've talked through a lot of this, and again, I will talk through kind of what these recommendations are with you as we have you come in and do an initial IV consult. So had a few questions that were asked before tonight, and so the FAQ here says it was some of these questions. How do I find a list of the IV options and pricing? And again, that's on our website at valleyvitalmedicine.com, the services tab, and then IV therapy. What if I have a significant health concern? So our goal is to be able to get you going with your IV therapy as quickly as possible. Okay. Now, if you want significant help with diving into optimizing your health and working on maybe some disease processes that you have that are significant, I would encourage you to set up what we call a discovery call. The discovery call allows us to determine really what your true needs are, as far as if you have digestive health issues, if you have autoimmunity, if you have Lyme disease, if you have these other concerns. Please call and set up a discovery call. That will allow us to do things in a systematic and a deeper level. If you are already working with somebody on those health concerns and you just want to come in for IV therapy, please just set up your IV consult. We'll just sit down with you, talk through a little bit about what it is that you're already doing. And we would love to come beside your other practitioners who are helping you to be able to help you to get the best results that you can. Okay. Are the nutrients synthetic? Yes, they are going to be synthetic because they are derived and in a pharmacy. Now, that being the case, these nutrients are bioidentical. Okay, so they're the same thing that your body recognizes as what you get from food. Okay. So yes, I mean, they're going to be synthetic anytime that anything is developed in a pharmacy. So why are the IVs so expensive was a question that I got. So what I would propose to you is that these IVs are not expensive, because if you go to the emergency room because you're dehydrated or you have other health concerns, the IVs that they charge you there, even if you just get saline, which is primarily what they're going to give you, unless they're going to give you some antibiotics, you potentially are going to end up paying multiple hundreds, if not thousands of dollars for those services. So what I would postulate to you, what I would propose to you, is that the IV services that we're providing are at a really high quality, a really high level, that you are going to get a great service, and ultimately it's not expensive for what you get with these therapies. Okay. Can you see a list of ingredients? Yes, certainly. If you have questions about, what's in what IV, I did a pretty good job, I think, tonight of breaking down exactly what's in these things. But our nurses do have a breakdown of the nutrients that are in each of the IVs, and they certainly will provide that to you. So what can you do to get the most out of your therapy? So this is a really, really great question. And so I wanted to take a minute to touch on base on this, because I think this is something that gets missed sometimes when people come in. So to get the most out of your experience, come early, be hydrated, go for a walk or a jog before you come in. What that does is it helps get the blood flow going. It makes it easier for us to find your vein and to get you taken care of in as quick of a fashion as possible. If you came in and you were sitting in the car for 2 hours to get here, which people do, and you're sitting for 2 hours and then you walk in the door and you sit back down and then you go sit down in the IV chair, your blood is not flowing well enough, and it's just good for you to move anyway. But the more active you are, the easier it is for us to be able to find those veins for you. So we have PEMF, which is pulsed electromagnetic field therapy. Helps to improve blood flow, prepares your cells for the nutrients. I would encourage anyone who's coming in for IV therapy to do PEMF beforehand, assuming that you meet the criteria for that. And we do have a screening for that when you come in. We can talk more about the details about that later. To make the most of your experience, we also encourage you to put your phone away. Okay. So the blue lights associated with phones just causes more stress in us, right? So getting you out of that stress state can help you actually absorb more nutrients. So one of the ways that we do that is we actually have a device here. It's called Brain Tap, which is a way of hacking meditation. So I encourage you to trial or utilize Brain Tap while you're here. So they've actually done studies on this, and they've proven that Brain Tap can help to improve your nutrient absorption by about 30%. So if you're coming in for IV, ask about doing a Brain Tap. We have one, and the nurses would love to give you that experience while you're here. It's about a 15 to 30 minute experience with that. What questions do you have? Let's see here. I see Kristen put a question in here. Is there an IV that helps the best with high TPO issues, TSH, and low iron? So when we're thinking about those concerns, generally I approach that from a more functional medicine approach, right? Where we are thinking about the digestive system and why do we have low iron issues. So we certainly could go deeper that direction. However, with the TPO issues, the thyroid, I would have a tendency to go more towards the ozone therapy, which has the greatest benefit in regard to balancing out the immune system. So that's generally my go-to for autoimmunity is the ozone therapies. Let's see here. I see another question here that says, can calcium and magnesium improve my diagnosed osteoporosis? Not necessarily. So the osteoporosis, so there's a few other things that we can do for that, and we can discuss that maybe more in depth later too. If you have a question, please feel free to reach out to the office. But for osteoporosis, I do think about hormone imbalances. I think about utilizing PEMF as well as perfect aminos, exercise, weightlifting, those kinds of things can be more helpful in regard to osteoporosis. And actually, the high dose vitamin C is actually going to be much more beneficial for you in regards to osteoporosis than calcium is. I don't recommend anybody take oral calcium. In general, your body doesn't know how to take care of it. Would you recommend for someone with Alzheimer's and their family and possibly showing signs? So again, the NAD would be a great thing to consider with that. I also do really, really like ozone therapy. Methylene Blue can be really, really great for those considerations. And then what about someone with arthritis? So arthritis is in general an autoimmune and also an inflammatory condition. So again, I would recommend ozone therapy as well as some of the higher doses of vitamin C for arthritis, but also we mentioned PEMF. PEMF would be really, really great, fantastic. We do have another therapy here as well. It's called SoftWave, which is a shockwave device that can be super, super helpful with pain and arthritis. Neuropathy, IV to replace gabapentin. So what I generally like to do in regard to neuropathy is I combine our SoftWave device, which again is shockwave, which can help to promote nourishment of the nerve and regeneration with our alpha lipoic acid IV. And so that's something that I can make some recommendations to for anybody that would come in and we did an IV consult with. Okay. All right. Whew. Lot of information. Thank you so much for the questions. Was this helpful for you? I'd love some feedback. If you would drop that in the chat or the Q&A. Any other questions here before we sign off tonight? I really appreciate all of you who have signed on and have joined me tonight. I need to excuse me. I need to announce our winner. So we did our drawing earlier with because we had our competition on Facebook, and we had many people who registered for an entry for a free IV. And so the winner for the IV is Naomi Roysom. So congratulations, Naomi. We will be reaching out to you in regard to the IV that you won. Any other questions or anything else that I can do for any of you as we wrap things up tonight? Excuse me. A lot of talking. Thank you so much for being here. Let me know what questions you have. We appreciate your support. I look forward to chatting with you. Let me know again. Feel free to reach out to the office, and would love to make sure that you're getting the most out of your investment of time and also your finances so that you can take care of yourself to the very best that you can. All right. Thanks, everybody. Have an amazing evening. And please feel free to reach out to the office with any questions that you have. Bye-bye.